Thank you very much, Ashley. I think I have I won the prize for the longest title for a national director. So it's one of the things I'm most proud of in my career, I think, really. What a lovely venue. It's lovely to be here. There's, as Ashley said, the toilets are outside, but there are also showers out there. So you can have a shower as well later on if you wish. And in terms of photographs, if you're photographing me, I prefer to be photographed from behind because I find it's my best aspect. So if you could do that, that would be great. Listen, it's lovely to be here in a really important event. The first Alcohol Research Conference, Integrating Evidence and Action, Shaping the Future of Alcohol Research. I think it's such an important topic. We all know that alcohol causes multiple harms in individuals, in their families, and in society. It's the root cause of multiple diseases that we spend huge amounts of money treating, and we need to spend a lot more effort preventing that harm. The recent research from the HRB, well, it's not that recent, but it's stark, is that 1 in 2 people in Ireland drink hazardly or harmfully, and 1 in 7 have an alcohol use disorder. That's phenomenal statistics, really. Ireland still has one of the highest rates of heavy drinking in the world, with about 40% engaging in episodic heavy drinking. So I think we don't need to be convinced here in this room of the importance of the topic that we're looking into the evidence for today and trying to understand better so as we can better support people to combat the harm that it does to people's lives. Many people, obviously, who have alcohol issues either don't realise they have or deny it and don't seek healthcare. So I think it's something that we need to be very aware of and be opportunistic in trying to identify as healthcare professionals. This brings us to the Making Every Contact Count program, where we try to explore some of these things in 1-minute interventions, evidence-based, where we can try and not just deal with what presents to us, but maybe uncover something in the behavioural area that we might be able to help people with. Because obviously when people come in to see us, it's a teachable moment. They're open to the idea, they're thinking about their health. If you meet them going down the street and you say, how much do you drink per week? They probably tell you to get lost, and understandably so. So I wouldn't recommend that. But when they come in to see you in a clinical setting, I think it really is an opportunity that we must try and seize so as we can try and help people, as I say, address issues that they may not even realize that they have. And I think, the other thing about alcohol is it causes harm to the people around the people who are being harmed by the alcohol. And I think we all know that as well. It causes all kinds of issues in terms of fetal alcohol spectrum disorder, but also violence, social disorder, family breakup. And like my clinical work is in the Granby Centre on Dorset Street. I work with the homeless part of the general practice services. And if you wanted to work anywhere to try and understand the impact of alcohol on people's lives, really, alcohol can be almost the only reason people are homeless. They can be going along kind of okay. Alcohol starts to get a grip. They maybe lose their job because they become erratic at work. They become erratic at home. They become maybe violent at home. They get thrown out of the home. They have no income. And then they're in my clinic. And it's very, very sad to see. And you can see people from all walks of life in my clinic. I can assure you of that. So it's just, and the other thing about it is, I suppose, in a way, like, we all know how harmful it is, but yet in Ireland, we've a phenomenally ambivalent attitude towards it. We might, on the one hand, say, yes, it's very harmful, and then we say, I'll meet you for a pint, after lunch or whatever. And you can hardly an event can happen in Ireland without alcohol. Somebody, their cap falls on the ground, it's a reason to go to the pub to celebrate. Anything, any issue, any happening is surrounded by alcohol. And it's the thing I say to the people coming to see me as well. I acknowledge to them that it's hard for them to avoid alcohol. It's everywhere. You go to the petrol station and they're selling alcohol there. It's selling it everywhere. It's kind of like the 3 A's that drive it, I think. Availability, advertising, and then I can't remember the third A actually. It's always dangerous when you go with 3 with a number, but it's just everywhere. And I think, in a way, the inequalities of our efforts to educate people about alcohol harm and the efforts of all of us here today to learn more about it, when you pitch it against the kind of finances that are put in by industry to get us to drink more, you can see the mismatch that's there. It's a very significant mismatch in terms of both power and resource. So we know we're up against it. And we're up against it generally in prevention because there are a lot of harmful industries that dwarf our budgets. And also it's hard these days, I certainly find, to get people to focus on long-term issues like prevention when the short-term issues are so overwhelming, like access, demand, trolleys, and all of those very, very important issues that we have to deal with in our health service. So it's not an easy battle. So I think everybody who works in this area are to be absolutely commended. And I think we have a wonderful team in health and wellbeing in the HSE, and the Healthy Ireland work has been really, really excellent. And most importantly, evidence-based. And that's why we have an event like today to delve more into the evidence. And we have three really good keynote speakers today, I think. Dr. Peter Rice and Professor Neil Fitzgerald, who'll be looking at the policy-making aspects of the whole alcohol issue and industry. And then Professor Julia Sinclair from Southampton will be focusing on health services. And I think we'll all learn a lot today. Certainly I will. And finally, really, I'd just like to kind of thank our own team, Aisling Sheehan, obviously, who you all know, Katie Dunphy, Sarah Hamdena, Noreen Turley and Lisa Noonan, who've kind of made today happen. And it's not like we brought in a big industry, conference organization industry. We've kind of done this ourselves, which we often do. And therefore, it's in a way, it's a friendlier event for that. And it's incredibly well run by a really great team. I really hope you have a really good day today, as I intend to. I hope you can interact with each other as we go through the day, and I know we'll all learn an awful lot. Thank you very much indeed.